Good evening, everyone, and welcome to this APRN Town Hall this evening. Please indicate in the chat that you can hear us, and you can also see our panelists. I would greatly appreciate if you can do that. And our panelists, if you're there, you can do the same before we do any welcomes. If we can get a thumbs up or anything to let us know that you can hear us, that would be greatly appreciated in the chat. We can hear you and we see the SCNA. Fantastic. Okay. Let me make sure you can see our panelists. You can hear and see. Fantastic. Panelists, are you able to see one another? I have a can hear and I have a no. Panelists, are you able to see? There we go. Right, everyone, just give me a second. This is a little bit of a manual process. I think I've got everybody but one moved in. Moving the last one in now. All right. Please indicate that you can see our panelists. Panelists, let me know, just a thumbs up. You can see one another. Fantastic. And if you can take yourself off of audio just to say hello, make sure everyone can hear you.
Hello.
Fantastic. I believe everyone is good. We should be able to see panelists now. They can hear. Can you all see panelists now as well? Someone just dropped that in the chat for me. And again, someone says they see Dr. Burgess.
That's scary.
Okay, I can see all of the panelists now. And they said they only saw you when you spoke. See everyone, I believe it's going to go based on who's talking, if that is correct. We can see them now. Fantastic. All right, everyone is there. Please forgive the person who is running the show back here, i.e. me. I am not your tech savvy person. But for those of you who are on, thank you so very much for being here with the South Carolina Nurses Association and the Coalition for Access to Healthcare this evening for this APRN Town Hall. My name is Tashika Curtis Pugh. I am the Executive Director of SCNA, and I am so excited to be a partner with this group to bring you this webinar this evening. I am going to turn it over to our esteemed panel, and I am going to be your background support. Please, please, please put your questions in the chat. You will not be able to come off mute to speak, but you can put any questions in the chat, and I will ensure that they are relayed to our esteemed panel. Also, if there are any questions that you ask that we are unable to answer in this moment, we will ensure that we get that information back to you. We should have your email addresses as you did register for this webinar. With that, I am going to stop talking and turn it over to our esteemed panel. And I believe Dr. Burgess.
Oh, Judy goes.
Yeah.
Okay, I'm sorry, Judy.
That's all right.
Okay. She the boss.
I want to welcome everyone to our second town hall meeting. We're hoping to hold these monthly so that we can get everybody on board for our full practice authority bill. So I would like each of the panel members to give a brief synopsis of who they are and what positions they serve within the Coalition for Access to Healthcare and SCNA. So Stephanie, would you like to begin?
Sure. So I'm Stephanie Burgess, and I'm a family nurse practitioner, and I am the vice chair of the coalition, past president of SCNA. Glad to be here. Thank you, everybody, for joining. We appreciate your time.
Deb Hopla?
Yeah, so I'm Deb Hopla, and I am a board member of the coalition and have been from the very beginning. Stephanie Burgess and I have worked on legislative issues since I was her student many, many years ago, and we have become fast friends and continue to try to move the state forward. I'm a professor at Francis Marion University, and we are trying our hardest to help all of the NPs. And I know we have NPs tonight. I saw their names that are joining us from the AANP conference in San Diego. So thank you for the
Yeah.
time change
Oh,
and thank you for joining us tonight.
I think one of them is Jada at the conference.
Jada? Jada
Jada,
looks like she's here.
Afternoon,
Oh.
not at the conference, but hello everyone. I'm Dr. Jada Quinn, president of the South Carolina Nurses Association, and also a former student of Dr. Burgess. And I'm so excited that you all have joined us this evening. I just want to say this: when nurses speak, legislators listen. These sessions are to galvanize you to continue putting forth the efforts to make change, the needed change that we need to take the best care of our patients. So we're excited that all of you have joined us this evening.
Thank you, Jada. Sharon Bond?
Hi, my name is Sharon Bond. I am a nurse midwife, retired faculty member from MUSC, where we had a midwife education program for nearly 40 years. We have that no longer, but we now have a new program at the University of South Carolina through the College of Nursing that we all worked on this board here very hard to bring to fruition, and it finally happened, so we are grateful for that. I have been a member of SCNA since I moved to South Carolina in about 1980, and I have known and worked with Stephanie Burgess on legislative issues since that time, although sadly I was never her student, but always a collaborator.
Right. Good friends.
Mhm. And Wanda Crotwell?
Hey, everybody. Wanda Crotwell here. I'm a partner at the Southern Group, which is a lobbying firm, government affairs consulting firm in Columbia, and I'm proud lobbyist for SCNA and for the coalition. I was also never a student of Dr. Stephanie Burgess, and I feel, but every nurse practitioner I've seen in my life was a student of Stephanie Burgess. So when people ask me if I'm comfortable with nurse practitioners, it really comes back to whether or not I'm comfortable with Stephanie Burgess. So happy to be with you guys tonight, and delighted to be working on behalf of all the nurses in South Carolina.
Thank you,
And we
Wanda.
appreciate you.
We do.
Thank you.
So on our agenda tonight is the Full Practice Authority Bill, Senate Bill 45, House Bill 3580, as well as the bill that was dropped on the last legislative day, Senate Bill 669. And we're going to discuss these and go over them and what our plan is for getting our Full Practice Authority bill passed. So I would like to begin with Stephanie Burgess, who's going to review Senate Bill 669 for us.
Sure. So Senate Bill 669 was dropped on the last day by Senator Danny Verdon. And I would like to give you all his phone numbers. 803 212 6250. That's his number at the Senate. And his work number in Lawrence, he's from Lawrence County, 864 984 4129. And this bill is called the what's it called? Team-Based Healthcare Act, which sounds really good. But there are a lot of restrictions, more so on nurse practitioners and other providers within the bill. In other words, if you want to have a practice, you have to appear before a joint committee at the Board of Medicine and the Board of Nursing so they can approve your practice and your collaborative agreement. They can even set the fee that the physician may charge you for being your collaborator. There are a lot of restrictions in there, not just on nurse practitioners, but other providers, nurse midwives, PAs, just another host of providers. But anyways, it's very concerning that he would do this. I'm not really sure what his agenda was, whether it was to galvanize people, to bring them together, to start the discussion. Maybe that was it. But he really lit a fire under a lot of professions, including the nurse practitioners, the nurse midwives. So in the meantime, we have been garnering support to oppose this legislation. And I'm sure Wanda Crotwell can talk to you a little bit more about which entities in the community are not pleased with the legislation, because there are a bunch of hoops. It's more restrictive, more regulations, more impediments, which really places more impediments to access and care. The bill will be heard probably in the fall with the other two bills when they have subcommittee hearings regarding all of this. We're trying to mount our support to oppose this bill, getting our physicians and our institutions that we work for to oppose this bill. Wanda, you may have other comments you might want to add to that.
No, that's a
TK.
great, yeah, that's a great summary of where things are, Stephanie. And among the groups who have concerns about it are the Hospital Association, have very, very big concerns about it. So do the federally qualified health centers. So any of you who may work with your local FQHC, the FQHCs have massive concerns about this because it's going to be very detrimental to their practice model that they use to run their centers. And of course, they're a little bit different. They're not a hospital. They're not just a doctor's office. They are those wraparound services and care. So again, it's a different type of model when you're talking about them. And this would destroy some of those centers if they had to do this. There's just no way that they could. So again, I think what Stephanie mentioned is important to note with this particular piece of legislation is that not only does it not push us toward autonomous practice, it pulls us in the opposite direction. Instead of doing away with, if they were going to say, we want a team-based approach and we want it to happen this way, and in return, we're going to give all advanced practice nurses autonomous practice, and you're going to be an equal member of the team, then we might have something that we could start a conversation on. But that's not what the bill says. The bill does not do away with your practice agreements. You still have to have those practice agreements, and you now have to be a part of this healthcare team, and that team has to be led by a physician. And that physician, not only do you have to appear before two different boards, as Stephanie mentioned, if you want to open your own practice, that you can have it just goes ahead and legalizes the fees that physicians are charging for collaborative agreements. And it also ensures that the physician lead of that healthcare team has to be a physician who is actively licensed and practicing in South Carolina. So you can't use a retired physician to serve as your collaborator. You can't use someone from out of state. So what that means is if you're serving a patient in South Carolina, but perhaps that patient's primary care provider is across the line in Charlotte, across the line in Augusta, or perhaps you're serving a child, or let's just say you're a parent, put yourself in the parent's position, and you're a parent with a child who has a very specific special need and a very specific disability or something going on, a condition they're dealing with. Maybe they're seeing a specialist at Mayo Clinic in Jacksonville. That specialist, who may be the best in the country, can't be the physician lead for your child's healthcare team in South Carolina because he's not actively licensed and practicing in this state. It undercuts all of telehealth and telemedicine and all of the gains that we've made there in the last several years. So the telehealth folks are up in the air about this in a massive way because it's contrary to everything that we need to be headed towards. So it is a very, very bad bill. We are very hopeful that perhaps Senator Verdon did this just by way of posturing, as Stephanie said, to perhaps get everybody to the table and say, look, this is how bad it could be. This is the other alternative, which is full autonomous practice with no strings. Now it's time to come together and figure out how we meet in the middle. Those conversations have not happened yet since session adjourned last month, but we expect that those conversations are going to be gearing up very, very soon.
Wanda, I just want to add that as we looked at this bill, we noted that it was essentially a blueprint right off the AMA website for their vision of how advanced practice nurses and physicians should work, not together, but one over the other. And that will not work for healthcare in South Carolina or anywhere.
It's very much the model bill from AMA with physician-led healthcare teams. And what you've heard at the State House all year this year is every time SCMA speaks about a bill, speaks about anything, they go back to that term physician-led, physician-led, physician-led. They start every paragraph with something about a physician-led approach. And so it's not surprising they came back with this. It's a little surprising that Senator Verdon did it for them, and a little disappointing. But again, I'm hopeful that it's just a posturing position to say, look, here's what the extreme end of this could be. Now let's work our way back to something that's more workable for South Carolina. So we'll see where things go. But it's in its current form, ladies and gentlemen, it is a very bad bill. And we are doing everything we can to make sure that 669, I'm not going to say doesn't see the light of day, because it's already seen the light of day, and I'm sure as the chairman's bill, it will see the light of day again. But we're going to do our very best to make sure that it's a one and done seeing the light of day, and that it doesn't come out of subcommittee. That will be our goal.
But in the meantime, we need our colleagues to go to this website. TK, if you could post that for the group, scstatehouse.gov, so they can click on a search for that legislation, and it's 669, and they can have that popped up and printed out. And we need them to call Verdon's office to oppose this bill. And that's why I gave those phone numbers out from the get-go.
Thank you, Stephanie and Wanda. The next on our agenda is a review of the Full Practice Authority Bill, Senate Bill 45 and House Bill 3580. And Deb Hopla, would you like to give us a synopsis?
Absolutely. Thank you so much, Judy. I'd like to say also that if you get an opportunity, go back and watch the taping of Senator Verdon dropping this bill. It was the last 5 minutes of the legislative session, the last day of Nurses Week, and he put it on Tom Davis's desk and said, "There you go." So, being the chairman, I can tell you that you will see this again. And when people sit idly by, this is when things happen. So let's talk about how we're going to change this, okay? So if you look at Senate Bill 45 and House Bill 3580, they're mirror images of each other. And so if you look at one, then you've got the other. And again, go to scstatehouse.gov and you can look the bill up and print it out so that you know exactly what the bill says. And in this bill, for nurses, nurse practitioners, and that's defined as certified nurse midwives, family nurse practitioners, clinical nurse specs. Yeah,
Right.
clinical nurse specs. And so when you're looking at this, to grant full practice authority, we have subsections of things that we are asking to be done. That first of all, that people, in order to be a full practice authority, must attain initial licensure as an APRN with 2,000 clinical hours, and possess malpractice insurance. And they have to attest to the board that they have done that. They have to have documentation to the Board of Nursing. And the board has to give their approval that they've done these 2,000 hours as an APRN. They have to notify the board if there's a change of practice sites, just like it has always been, within 15 days. And the full practice authority granted by the board says that people can independently do specified medical acts and non-medical acts without a practice agreement. Now, it also means that you can order and interpret diagnostic data, you can do assessment and diagnosis, prescribing medicines, interventions and therapies, delegating and assigning therapeutic measures, all of those things that we are going to be able to do without having to have that collaborative agreement. And remember, right now, every physician in the state of South Carolina can have up to 6 NPs, PAs on their license or combination thereof, full-time. And when we did a survey, we were able to determine that the average NP is paying $2,000 a month to have that signature. $2,000 a month times 6 is $144,000 a year for a piece of paper. So kind of be aware of that. And when you're looking at what we're asking is that you have to have a minimum of a master's degree and those hours of 2,000 clinical hours. And those can be done within those 2 years. If you're working part-time or if you're working full-time, as many people do, those clinical hours can be met sooner. When you're looking also at, let's see, hang on. Prescription drugs, you can still do prescription drugs at free medical clinics. You can still sign for samples. You can delegate tasks to medical assistants. If you do not have full practice authority granted by the Board of Nursing, then you still have to have a practice agreement with a collaborative physician and be able to present to the Board of Nursing within 72 hours of their request that collaborative agreement of what they authorize you that you can or cannot do. In order to write prescriptions, you still have to meet the requirements of having those 20 hours. And every 2 years, you have to have pharmacotherapeutics with 2 hours of the 20 hours being related to controlling people with controlled substances. When people have full practice authority, they will be able to write for Schedule IIs and not to exceed a 30-day supply under, and for people with getting brand new prescriptions for narcotics, you know, the governor mandates only a 5-day supply. However, the provider for a patient in chronic pain management facility under hospice or palliative care or in a service long-term facility can write for 30 days with renewals. Let's see. Also, sorry for the background noise.
Deb, can I interject? We also put in there that a ClinSpec or a Psych NP could sign that paperwork to have a patient committed if they were a danger to themselves or others. That was very important to the Psych and
That's
the
right.
ClinSpec folks who do psych mental health.
That's exactly right. It also still allows the APRN to be able to do telemedicine. And remember, under telemedicine, you still have to maintain medical records for patients and follow all of the guidelines through HIPAA and through high tech. So making sure that you don't do telehealth like in a grocery store, make sure you do it where you're in a private place because people have been sued. You just don't want that to happen. But this gives us the ability to take care of patients. And as you know, we really just don't have enough people to go around, not enough physicians to go around. I just came back at 1 o'clock this morning from Canada and at Prince Edward Island, where NPs do have full practice authority. Not every province in Canada has this, but they have the same problems we have. Patients are going to emergency departments for primary care. We know that the top 100 reasons people go to the emergency room are things that could be taken care of in primary care, whether it's bronchitis or UTI or ear infections, that kind of thing. Not a true emergency, but the same thing's happening in Canada. So they also found that it was much better. They don't have enough physicians. And again, even with universal health care there, they find that there's not enough people to go around. And we have the same problem here in South Carolina, as you well know, we rank an F in healthcare. The March of Dimes just came out with their latest study for maternal and infant deaths. We have not had a vast improvement in those areas, but NPs can make a difference. Certified nurse midwives can make a difference. And we need to everybody get on board to be able, when we have these subcommittee meetings, to be able to go there in mass, to be able to speak the language that they need to hear. They need to hear your voice. Without hearing your voice, they just absolutely will take Denny Verdon's side. And right now, TK reminds us that 15 counties have absolutely no OBs. When you're looking at psych mental health, there is one psychiatrist for every 100,000 people. And looking at psych mental health NPs, there again, there's not enough people to cover the need in South Carolina. So anybody
One
else?
more thing.
Yeah.
I'd
Yeah.
like to add,
Yeah.
on the Coalition for Access to Healthcare, our group here, there are 2 certified nurse midwives on the board, myself and Leslie Rathbun. And we have language in the bill to help support hospital privileges for nurse midwives. We have a little bit of tinkering on to work with on that language to make it more amenable, but that's part of our job. And there are good things going on. There's increased government and media attention on the maternity crisis in the United States, and specifically in South Carolina. And it's on everybody's mind. The legislators are familiar with it, and everybody wants to improve. And every study that's been done about the maternity crisis always points to the value that certified nurse midwives could add to improve the situation, that we are a key contributor to improving maternal health wherever we work. So we remain under-recognized in South Carolina. There are not nearly enough of us. We're hoping that our new education program at the University of South Carolina will help improve those numbers. But let's get going. We need all the advanced practice nurses to be working at the full extent of their education and training in our state. And the fact that we have 15 out of 36 counties with no maternity care provider, that's shameful. That should not be happening. And that's the reason why our statistics in the state are so poor for mothers and for babies.
And to tag on to that, by the year 2030, they are projecting an additional 815 deficit physicians more. I mean, and that's across the board. So in addition to what we have now or don't have, we're going to see another deficit, an additional deficit of 815 physicians. So somebody's got to give the care. I think we have, what, 22 counties, Deb, that have less than 3 family practice physicians, and those physicians are aging out. My physicians are aging out. 2 of them have retired this year. And I was in panic mode for a good while because if I don't have a physician, I can't see these patients, of course, and they go without care. So it's really an issue. So I just wanted to make sure that we all show up at those hearings, even though you may not speak. Come and show your support because we need you there and we need you to write letters. And I think Judy Zink has posted some template letters on the coalition website. And I think Rosie has some information as well from the last town hall. Thank you.
And when you show up, make sure you wear your white lab coat. Make sure you have identifier so that they understand who you are. Always be professional, always be courteous. You know, we don't want to go into mudslinging, but we want to make this about the patient care. We want people to understand this is about being able to provide the care to patients. And South Carolina needs a better ranking than F in healthcare. Patients deserve it, South Carolinians deserve it, and nurse practitioners deserve to be recognized for their education.
Thank you, everybody. This is a great segue to go over to Wanda to talk with us about the key legislators and how to get legislators to sponsor our bills.
Thanks, Judy. And one of the things I'll also mention about the bill as we talk about the summary of the bill itself, and I think it's important to also mention, which again, we haven't talked about a whole lot in the past, but it's to me, a very important component of the bill. And that is that autonomous practice in this bill, the way that it's drafted, is not mandatory. It's permissive. And so once an APRN gets 2,000 practice hours under a collaborative agreement or a practice agreement with a physician, that APRN has the ability, the authority to apply to the Board of Nursing, and assuming that all of the boxes are checked and you've got the hours and you've got the education and all those things, then the Board of Nursing will grant you that autonomous practice. There may be APRNs out there who say, I don't want to be on my own. I don't want that level of malpractice insurance. I don't want that legality and responsibility. You don't have to have it. And so I think that's the important piece of this. It's also incredibly important for us to continue to focus on is we're not forcing APRNs to go in a direction that they may not be comfortable in. We just want to open up that avenue for them if they choose to pursue it. So again, I think that's an important piece of this particular piece of legislation as well, because there are going to be some APRNs out there who just say, look, I love my physician. We're like peanut butter and jelly. I just want to stay right here. It's been a great first year with this practice agreement. I finished his sentences, he finishes mine. I would like to just keep this. Cool. That's all good. Keep it. Nobody is forcing you to do away with that. So I think that's important for us to remember is that this is a very it's a very permissive bill, and not a lot of mandatory kind of requirements in there. So I think that's really important that we remember. Again, do I expect the bill to change as we go through the process? Sharon has already alluded to one change we're already working on. There's another change we know we've got to make simply because there was a drafting error and one particular piece about practice in rural and underserved communities was not picked up and put in the FPA portion of the bill. It should have been. It remained in the Practice Act portion of the bill, but not the FPA portion of the bill. We've got to do an amendment to add that back in because that was completely inadvertent, and we want to make sure that stays in there. So we're going to make some tweaks on this as things go along through the process. In the meantime, however, it's the concept at this stage of the game that I think it's important for us to start talking to legislators about. That same website that everyone has referenced and TK has already included in the chat box is where you will find not just Danny Verdon's contact information and not just a copy of the bill, but you'll find your legislator. And you can look up your legislator by zip code. You simply plug in your address. It will take you automatically to the legislators who represent your district. And those will be the folks that you are well within your right as a citizen of this state to call and say anything you want to them and ask them to vote however you want to vote, and you're not lobbying because they are your elected official. Okay, so that's very, very important. You're not crossing any lines, you're not lobbying, you don't have to register to do that, as long as you're talking to your elected official. Okay, and it's important to go ahead and start doing that. Okay, they can't add on as co-sponsors now until they reconvene in January because now they're not in session. But I know a lot of you did reach out during the session that's just completed, and you got a lot of verbal commitments from folks who said, I'm all in and I'm going to sign on with Senator Davis as a co-sponsor, and I'm going to sign on with Representative Smith as a co-sponsor. But that just didn't happen. We had a lot of verbal commitments, but none of those came through. We have one. I talked with Senator Jeffrey Graham and from the Camden area, Camden Sumter area, and he has signed on, a Democrat has signed on as a co-sponsor, which is nice because our Senate bill is now a bipartisan bill with a Republican and a Democrat both on the bill as co-sponsors, which is ideal. So again, it's just time to sort of call in the chips and remind the folks who said they'd be glad to sign on for us, and to make sure they're set to do that when they return in January. Now, obviously, this is the biggest thing in the world to us right now. It is not the biggest thing in the world to every legislator, right? They've got a dozen things that people are already pinging them about, and they've been out of session a total of about 3 weeks, and they're already getting beat up on a whole lot of other things. So it's going to be important that we continue the conversations as the off session continues between now and January. But guys, now is the time to have those conversations with them in district. Once they come back in January, your task, your challenge, should you choose to accept it, it's like Mission Impossible, right, is to meet with your legislator, preferably in person, with your senator and your House member. Ask them to go grab a cup of coffee, ask them to go grab lunch, or ask them if you can stop by their office and talk to them for 20 minutes. Just call them in district. They've got more time on their hands now at home in district than they do when they're in Columbia with me 3 days a week, January through May. Their time in Columbia is so limited. Literally, they come in at noon on Tuesdays. They're gone by about 1 or 2 on Thursdays. So truly, I've got them for about 48 hours. That's it in the course of a week. They're home with you guys in district now 24/7. Now's the time to catch them and have those heart-to-heart conversations with them. Answer their questions. Let them know what the bill does. Let them know what the bill doesn't do. It doesn't make us physicians. I say us because I'm an honorary nurse practitioner now. Y'all just don't know that. But I'm saying us like I've got a degree. The point is, it doesn't make any of you physicians, and you're not asking to be physicians. And that's what they need to understand. And that's the talking point we need to stress, which is you all are not asking to be physicians. You're just asking to practice autonomously at the top of your license, what you're absolutely trained and educated and certified to do. That's all you're asking for without additional red tape from the government. That's all you're asking for, and this bill accomplishes that. So we'll get you basic, really basic talking points along those lines. If senators have a different question or House members have different questions that you're not able to answer or not comfortable answering when you talk with them, we can certainly get those answers for you and follow up with those members. But they need to hear from people in their district, because otherwise we will come back in January and what you're going to hear is, I'm going to hear, Wanda, you're telling me this is a big deal and this is a big issue, but I'm just not hearing about it at home in district. Nobody's talking to me about it. I'm not hearing about it. So I know you say it's a big issue, but the nurses are paying you to say it's a big issue, but I'm just not hearing anything about it. They have got to hear from you all. They hear from me every day. They got to hear from you all in district, because that's what pings the lever and lets them know that I'm not making this up. This really is an issue. It really needs to be fixed. And here's how it's really working right now and how it could work better under this new bill. And I think that's the message that we need to make sure we get out in the coming 5 months, 6 month period.
Thank you, Wanda. Stephanie, Kelly's not on the call today. So could you do her part with Wanda on a review of the frequently asked questions, talking points, and this preliminary data?
I wasn't planning on that, but we do have the
Uh,
FAQ posted, right, Judy, on the coalition website?
Not on the coalition website yet, but it will be there this weekend.
Okay. I know we sent the coalition a bunch of stuff, and Judy is working with the webmaster to get all that stuff posted. But there's FAQs on there. There's sample letters, sample templates for testimony, what you need to wear and how you should act during providing testimony. We have a link to the bills. I mean, we just have tons of information. We have information about the state in terms of the health stats, the counties that we've all alluded to earlier. I just don't have all that information in front of me, but there is so much information that you all can access. We also have one of the questions that was asked about disciplinary cases. Well, if we let nurses be independent, what about the disciplinary issues? So less than 0.1% of APRNs have been disciplined over the past 20 years, and that data matches the state board, not the state board, the National Council of State Boards of Nursing disciplinary for APRNs, and that includes nurse practitioners, nurse midwives, and CNMs. So the data doesn't really show that we're out there practicing malpractice. We're actually doing good things. The AHEC workforce data, I believe Judy has that link. She's going to get that posted. And it did show that nurse practitioners are maintaining primary care in this state, and that our numbers are growing exponentially faster than physician colleagues, because the med schools are just not churning out enough family practice and primary care physicians, OBs, pediatricians, so forth and so on. So, I mean, I don't know what else to say, but the data is on the coalition website, and Rosie at SCNA also has that information, and I believe she posted it or put it in a folder for people to access. And somebody posted a question, can you send the dates of the hearings? We do not have those dates yet, but they will be on the coalition website. They will be on the SCNA website, and we will try to get emails out to everyone to so that we can make sure people have those hearings. But it is my understanding they will be late summer or early fall. Is that right, Wanda?
Yes, Stephanie, we expect it to be sometime in September. It is the last word we got. Senator Verdon, when he dropped his bill on the last day of session, mentioned having hearings after Labor Day. So I think they're going to take the summer. A lot of conversations will go on behind closed doors, which is why it's time for us to have these conversations now, because I promise you those conversations have already started between leadership to figure out how this is going to work. And then they're going to go do the public part in September. But those conversations about how we're going to deal with this going forward are going on right now, are going on to literally today. Was one of those conversations, and so now is the time to be talking to legislators and making this an issue for them.
And
And
TK
guys,
said that she was going to send a blast out to all the APRN members once they get the dates for the hearings. So, and they'll be on social media platforms. And we do have a social media for the coalition, and we will make sure she gets it out. So we're trying to reach as many APRNs in the state about the hearing dates, but it is critical. Everybody show up, even if you don't talk. Show up in your lab coat, make sure it says family nurse practitioner or nurse midwife, whatever. Make sure you show up.
And tell your friends, you know,
And
we can only reach a certain number of people,
right,
but you have friends that are APRNs. And so make sure that you reach out to your friends and let them know.
correct.
yeah, I would say if you know folks who know legislators, you know that 2 degrees, 3 degrees, 7 degrees of separation, whatever it is, all of those things are very important, guys. If your best friend goes to church with Senator Bennett, um, that connection will be incredibly, incredibly important, because if he hears it from the person he goes to church with, who's a friend of his, and your mutual friends, that yes, I go see a nurse practitioner. That's where I get all of my primary care. I adore my nurse practitioner. I don't know why y'all keep them under the thumbs of physicians. I don't know why y'all require this red tape for them, because in talking to them, it's killing them. And I love my nurse practitioner. If a senator hears that from someone he knows and it's not a nurse practitioner, that is golden. That's like best case scenario when you have other people, be it patients, be it friends, whomever, be it whatever, going to legislators and singing your praises. That's the cat daddy right there. It's what we're looking for, because again, we're obviously going to say we're wonderful, because we know we are, but to have that coming from patients, to have that coming from other folks to members of the General Assembly, incredibly, incredibly important.
The coalition is also accepting letters. We have a lot of physicians that are supportive. And so if
Yes,
you have a physician that is supportive, please have them write a letter of support and please send that to the coalition.
Send
I'm
it to
sure,
me.
yes, yes. Stephanie, why don't you put your address in the
I,
chat?
I am.
And patients, when you have patients that just love you, have them write those support letters. Corporations, we have a number of corporations that love having NPs. Our FQHCs could not function without our NPs. So get those support letters sent to us, because we're taking those letters with us when we go.
we are. We're making a whole folder, and if any of you provide services, provide health care in a Minute Clinic, the Convenient Care Association, massive supporters of this piece of legislation, because again, they got to have nurse practitioners in their Minute Clinics, or they just are not able to operate. And it's getting harder and harder to find that physician for those collaborating agreements where they have to have it. So this is much sought after for them as well, and more people are getting their health care from a Minute Clinic type of setting. And so it's incredibly important that the folks that are there are prepared to do the right thing. So again, any of those letters of support, and I'll flip that coin a little bit and say the converse is true as well, which is not to slam physicians. That's not the other side of the coin I'm talking about. But I literally had a checkup today, and my physician has retired. And so I saw my new primary care provider, and it's the sweetest nurse practitioner. She's wonderful, and I fell in love with her today. But it was a great conversation with her, because she's taking over this physician's client base. She's now their primary care provider, but there's a high percentage of geriatric patients, a lot of whom are on controlled substances for chronic pain management. And she's very hamstrung in what she can do as a nurse practitioner. And for a few of them, she's had to tell them, I don't know that I'm the best provider for you because of what you need to be able to deal with the back pain that you had from 7 back surgeries. I think you may be better off seeing a physician. And so for her to be in a situation where she's having to come in and make that assertion, that's a letter in and of itself to say, please, please, please free me up to serve my patients because right now I'm not able to do it. Or conversely, have the patient send letters that say, please, please, please free up my nurse practitioner so she can provide services to me because I don't want to leave this practice. And again, this is real life today. I'm preaching to the choir. You all know it, you live it every day. But just a very interesting situation right here at home. And all of this is happening as the physicians in that practice are retiring out. And the system that this particular practice is going from one healthcare system to another healthcare system in terms of who owns it. So the providers are getting split up that are remaining, and now they're redoing collaborating physicians and the whole 9 yards. It's just a nightmare. And the patients are just there to get their yearly blood work done, you know? So they just want to make it easy. And could I please get in and not have to wait 7 weeks to get in to see somebody? So again, those are the kind of things in the real life stories we need to make sure that legislators are hearing.
And for those of you who have had your physician retire or move or sanctioned and not able to be a collaborative physician, we need those stories as well. You know, we had a complete group of a school down in Johnsonville where the nurse practitioner was taking care of over 3,000 children. Her physician got in trouble, got sanctioned, and overnight she had to stop seeing patients. Couldn't get another physician to sign on as a collaborator. So those kinds of things are happening to you. When they happen to you, please let us know. Put it in writing. Let us know your physician retired or moved away, or that you had to go on collaborating docs and hire somebody. Again, it's important that we know those situations. So please write the coalition and let us know those scenarios.
Thank you, everyone. The last little thing we have on our agenda today is talking about testifying at subcommittee meetings. So I'd like to open this up to everybody on the panel and tell us about your experiences testifying and what we as APRNs need to do to testify.
How about if I start?
You go ahead.
One of the things you have to be prepared for is you only get 3 minutes to give testimony. So you want those, you want that written out. You want to know very succinctly your 3 minutes of time to be able to tell the legislators what's important. You also want to dress professionally. You want to make good eye contact with the panel. You want to be prepared because even though you only have 3 minutes, they can ask you as many questions as they want to. You have to sign up. When you first get there, you have to sign up if you want to speak. If you don't want to speak, just be in the galley. It really does help for people to be in the galley in support. But again, once you sign up, have your testimony written out, 3 minutes or less, but be prepared to answer questions. I did testimony and subcommittee one time, gave my 3-minute spiel. 45 minutes later, they finally let me sit down. But be prepared with that 3-minute spiel of what's important, why it's important, be succinct.
Yeah. Thank you, Deb. Stephanie, do you have anything to add?
No, I think that's great. It's just really important that if they ask you some questions and you don't know the answer, you just say, you know, I don't know the answer to that, but I'll get back to you. But don't make stuff up. That's bad. And number two, if they get in your face or ask you some testy questions, you just be very polite and very respectful. You do not get mad and you do not get angry. We've had some groups do that before. I'm not talking about us, but I've seen groups do that before, and it really creates a problem for the group because it puts the legislator on a bad note, if you want to. So try to be polite, respectful, and if you want to blow off some steam afterwards, that's fine. You go to your colleagues and blow off your steam, but you never do that to a legislator, and you never do it in a committee hearing. I know that sounds silly, but it's just important to be polite and respectful.
Thank you, Stephanie. So the last little bit of our agenda is just a review. And so as we had discussed earlier, that we should be having some hearings set up for this late summer, early fall. Remember to prepare your testimony for the hearings if you wish to testify. We're asking everybody to contact their senators and House members for supporting Senate Bill 45 and House Bill 3580. And also ask them to not sponsor Senate Bill 669, as that sets us back another 20 years. Definitely sets us back to before 2018 when our last bill passed. We're also requesting everybody to contact Senator Danny Verdon, who so far is the only sponsor for Senate Bill 669, and let him know that you oppose the bill and why you oppose it. And hopefully by doing all this, we'll get rid of 669 and we'll be promoting Bill 45 and 3580. So I'd like to open this up to questions. TK, do you have any questions for us today? And you're muted, TK.
So the only question I see right now is, should we focus on our senators when we approach our own representatives? I don't see anything else right now.
So in the Senate Bill 45, you want to talk to your senator from your district. With the House Bill 3580, you want to talk to your representatives from your area. And again, make sure that it's very personal. Make sure that you tell your story and ask for their support. We're really good about telling our story, but then we don't tell them what we need. So always ask. We would like to have your support. And this is why. And tell them about South Carolina. Tell them about the state of healthcare and tell them about what your personal story is. And just be prepared. If you don't know the answer, like Stephanie was saying, just say, I don't have the answer for that, but I can find the answer and get back to you. Is that okay?
So just a few things I'm just going to share from the chat as well, because some of you may not be able to see these because they shared to host in the panelists. There are currently 17 counties with no psychiatrists, 22 counties with less than 3 family practice physicians that are currently aging out. There are 10 counties with no pediatricians. There was a question about the address for the coalition. I will copy it again and put it in the bottom of the chat so you can copy that. There was a question, is there psychiatric data also on the website for reference when we speak to our reps? And the answer is in the chat, but you're not able to see it. And it says, yes, the information on counties with numbers of providers and psychiatrists will be on the Coalition for Access to Healthcare website. We'll make sure it's on the SCNA website as well. There was another question about the letters for the templates. I think you all spoke to that. I'll copy the email and the address again. Someone asked about making sure their contact information was taken in. I have that, and the representative. So I think we're good there. I don't know. I think that's
TK,
everything.
I have
Dr.
one
Quinn
more
has anything?
thing.
Go ahead.
Yeah, I have one more thing. I would ask, if you're not a member of the South Carolina Nurses
Oh,
Association.
that was my ask. I was gonna wait to the end. I love you for it. Thank you.
I was also going to say the coalition, the South Carolina Nurses Association and the coalition both help to sponsor our lobbyists. We cannot, all of us are other jobs. We cannot be at the State House, but Wanda is there on our behalf. She is always looking out for us, and that requires money. So, you go to Walmart, you can spend $100 on garbage that you don't even know what you bought. But when you donate money, all of us are volunteers. Every last person on this coalition is a volunteer. And so that money goes directly in to help support our lobbyists. So again, the AMA gets lots and lots and lots of donations. But the coalition needs your donations as well. You can send that to Dr. Stephanie Burgess. She has put her address in there and put on there for the coalition to access to healthcare. Because again, none of us take a dime. It all goes to help support our lobbyists. So please consider supporting your profession.
And join SCNA.
I'm gonna take a point of personal privilege and turn it over to Dr. Quinn for a second, and I'm going to put join links in the chat while we do that, if y'all don't mind. Dr. Quinn?
Yes, thank you everyone for joining us today. And also thank you to our Coalition for Access to Healthcare. We could not do this important work without this partnership. So I again echo our coalition partners who are also members of SCNA. Please join us. We do need your membership. We need your voices. We need you in the building when these testimonies take place.
Bingo.
Thank you, Jada.
There is an additional question. Thank you, Dr. Quinn. Another question that says, are there any ethical concerns when asking patients to send a letter of support or an appropriate way to address it?
I don't think there are any ethical concerns, and I see Stephanie just responded. There's not. You don't want to make a patient ever feel uncomfortable about it. I think just if it comes up naturally. And so again, I think, as you're having conversations with your patients, because Lord knows y'all spend a lot more time with your patients than a physician does. Physicians in and out in like, what is it, 6.2 minutes or something like that. And you guys you have a better relationship with your patients. And so I think if something comes up and the opportunity presents itself naturally to have that conversation, then I think that's when you broach it. I don't think you want to make your patients feel uncomfortable in any way, shape, or form, like you're soliciting from them. But I think you'll feel it. And if you're having a conversation like I was today with my nurse practitioner talking about, that the frustrating part is I can't do this for these patients because of the way that the practice agreement is set up here in this practice. And I have to go track down one of our 2 remaining physicians to give him a prescription for his back pain. Stop. Stop, 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 stop. So yes, that sweet little man, she's the sweetest little old man. But that sweet little man, when he's frustrated because he loves her and he can't continue to see her because it's just not practical because she can't take care of needs, then that's the type of thing when you just honestly say, listen, if you're so inclined, we're trying to change this. We have legislation to try to fix this. I don't know if you ever get involved politically. I'm not asking you to, but if you would feel comfortable doing it and want to, let your legislator know. And you'll be surprised how many of those folks are probably going to say, well, yeah, I know him. He sits behind me in church every Sunday. Yeah, I think you'll be surprised how many of your patients are going to say that. Well, yeah, I know him. We meet every Wednesday for coffee before he goes and plays golf. I know exactly who he is. I think you're going to hear that more often than you know. And so I think, it's just going to be a matter of having it come up very naturally, but no ethical concerns. You're not asking for any money. You're not asking for them to contribute to a campaign. It's just a letter of support as a constituent of that particular senator or House member.
And we do have template letters, Judy Zink, I believe, for patients. So you can have them printed out and they can sign it. That way they don't even have to think about it. But I mean, you don't want to coerce them, but really
Right.
a lot of my patients, I've told them about our legislation and yeah, I'll sign that letter. What do
I
you
think
mean?
that's what
What do you mean I have
yeah.
to see the physician? I want to, no, I'm going to sign that letter. So.
I think you're going to see a lot of that, and I think it's important that we look at that. And again, I'll go back to a point that was made early on, just because as we get ready to wrap up, this is an important one. If you work with a physician who is supportive
Yep.
of advanced practice nurses having FPA. Oh my goodness gracious sakes alive, I could use a letter from that physician. If that physician is willing to pen an op-ed, if that physician is willing to write that letter or testify, I will take all of those I can get. And I think you'd be surprised how many physicians you're going to hear, especially in hospital settings, but also in family practice settings and other situations that are going to say, I could not function without the NPs in my practice. It's impossible. I could not see the patients. Turn them loose and let them practice, for goodness sake. I don't oversee them anyway because they know what they're doing. I think you'd be surprised by that. And you all know your physicians much better than any of us will. But if you have a physician that feels that way, the more physicians we can show in support of our legislation, the harder it's going to be for SCMA to defeat us, because it's a divide and conquer mentality, guys. And so if you can find me any physicians so that I can show this is not just a nurses thing, that's ideal.
Get the letters, show up at the hearings, and meet with your legislators. Get them to support our bills and oppose 669.
So I am going to give us a closing round robin. And I would like each of our panelists to take 1 minute, no more than 1 minute, and close us out with your elevator pitch and or what you would like for everyone to walk away from this today. If you all could just give us the sounding, the call to action going out. If every one of you could please do that, I think it'll be a great way for us to wrap up, as I don't see anything else in the chat. And if you don't mind, I'm going to go with the way my screen looks. So I'm going to start from left to right because that's the way we read. And I'm going to start with Dr. Deb Hopla.
South Carolina is in need of healthcare providers. South Carolina deserves the best. Nurses are the best. We're the most trusted profession for a reason. Let us do what we do best, and that is take care of patients. Thank you.
I mean, 30 seconds, that's what I'm talking about. That's fantastic. Dr. Hopla, I'm going to turn it over to Judy Zink.
I want everybody on this call to feel empowered to get out there and call or write their legislators, support SCNA and the Coalition for Access to Healthcare, and to remember that we want more than anything to provide access to care to our South Carolina residents. And that means all of them, not the ones that we can cherry pick like some of our other providers have done.
Awesome. Sharon Bond.
Nurse midwives are a key to improving maternal health in South Carolina, no matter in what setting where we work, hospital, outpatient clinic, home setting. Our outcomes with mothers and babies are as good, if not better, than those of physicians. We are cost effective, we provide safe care, and if you are a nurse thinking about a career change, think about nurse midwifery. You are badly needed and very valued. Contact the University of South Carolina College of Nursing.
Awesome. And Dean Baumstock is phenomenal. Director Baumstock is phenomenal at USC College of Nursing. Dr. Burgess.
Thank you. I want to thank everybody for being here. So here's your assignment. I want letters from patients, physicians, institutions. Email them to me at scburgess at AOL.com. I want you to meet with your legislators, get them to be a supporter of 45 and 3580 and oppose 669. I want you to show up at the hearings. We're going to post the hearing dates, but they will be in the fall. And the purpose of the legislation is to save money, increase access, improve patient outcomes, and remove these ridiculous regulations that are impeding care. The end.
Outstanding. Outstanding. That's why we have a Dr. Stephanie Burgess Advocacy Award right there. So if y'all want to find, if you find somebody you want to recognize for that, go ahead to the website and do so.
Y'all need to.
Wanda, who is a honorary nurse practitioner. She
Yes.
says.
Listen, there's nothing that I can say to add to what has already been said here. These ladies have wrapped it up beautifully. South Carolina, along with the rest of the country, but particularly in the South, South Carolina is in a healthcare crisis situation, and there are ways to address it. And one of the surest ways to address it is to get government overregulation out of healthcare and give patients the choice to choose the provider they want to see. This is very much a time in which patient choice is at the forefront of everything being discussed. Make this about giving patients the choice. If they'd rather see a physician, that is absolutely fine. But if they want to see a nurse practitioner, if they'd rather see a certified nurse midwife, why would we not allow patients to choose that on their own? And I think if we hit that overreach by government and if we focus on patient choice, I think we'll pull a lot of Republicans into our argument.
Awesome. Dr. Quinn?
Again, everyone, join South Carolina Nurses Association. And remember this, nurses tend to be very humble in the provision of our care. You have to start talking about the good work that you are doing in your workplaces and in the community. Highlight your colleagues. Sometimes it's hard to talk about yourself, but highlight your colleagues. Let everyone know, let your community know what you're doing and what nurses and nurse practitioners offer, APRNs offer to our South Carolina communities. If we talk about it and it becomes the fiber of our being, the message will ring loud and clear. When we talk about it, they will hear about it.
Awesome. I think we have gotten to the wrap. I see a ton of hearts and thumbs up and claps and all those things. I will end with just this. Everything that you've heard tonight, your task is to make sure you share it with someone who was not on this call. This will be recorded. This has been recorded and we will get it up on the website. But your task is to make sure that your APRN friend knows about what was spoken about on this call this evening and that you share it with them. This is more than an ask. It is a mandate because the only way we get this done is to do it together. So with that, the Coalition for Access to Healthcare and the South Carolina Nurses Association, thank you all for joining us this evening. We look forward to getting this done together, and then we will start on the next big thing, whatever that is. We know that Medicaid expansion is a part of this work. I'm just going to do that quick plug, so know that we'll be thinking about that as well in this state. But most importantly, getting you all full autonomous practice is what we have to get. So again, on behalf of the Coalition for Access to Healthcare and the South Carolina Nurses Association, thank you for being with us tonight. Have a wonderful evening, and we will see you soon. Bye, everybody.
Thank you.
Bye-bye,
Thank you.
guys. Thank you all.
Thanks to all the attendees.
Thank you, everyone.
So I
Bye,
close
everybody. Thank you.
out for the attendees. And now I am taking us off air. Any questions, any concerns? I think y'all did a phenomenal job tonight.
Oh, thank you,
So
TK.
very-
TK, you did a great job too.
Hey, TK, there were a couple of things in there where someone said they were driving, Heather
I got
Garrett.
it. Yep,
Okay, great.
yes.
Thank you.
I got screenshots and I'll also get a full synopsis that'll come in my inbox probably tomorrow. Okay, it says we're still public. Maybe I didn't take everybody out, but that's okay. Y'all can drop off. We're not talking about anything now. But I got a full synopsis, so I'll make sure everyone gets those notes. Please note that I am on vacation as of 7:15 this evening.
Good for
Yay.
you. And
Congratulations.
TK,
I will not be answering any emails, but I will when I come back. We come back on Tuesday and then we leave straight for membership assembly on Wednesday, but we'll be working while we're in DC. So if you have anything or need anything, I got you come Wednesday. But thank you all so much.
TK.
TK, could
Thank
you
you.
send me a list of the attendees so I can
Yes.
let them
Yes,
know when
Yes,
the
ma'am.
website's updated?
Yes, Rosie will pull that. She can probably pull it as early as tomorrow if Zoom updates. If not, she'll have it by Monday and we'll make sure
Thank
you
you.
get that.
And also, I will make sure, I know I emailed Rosie a bunch of stuff from the last webinar, but I'll make sure that she has all the letters and whatnot that she needs.
Yes, ma'am. And we'll put them in the legislative link, and we'll also make sure they're uploaded to the app as well. So people
Okay.
can get them from the app, the website.
Okay.
We'll put them on the social media, all the ways we can get it out to everybody. And I'll tell you, while I was on this call, I sent text messages to 5 different representatives and 4 senators and said, I need your help, because these are people that I have relationships with. And I'm like, I don't see your name as a co-sponsor on these bills. What you doing? So
Good.
hopefully they will do that. But thank you all. This was great. And just know that in the last 2 webinars, we've touched over 200 APRNs.
Yay.
So, I know that's not the thousands that we have, but to know that we've touched that many, and if those many, touch somebody else, we're gonna be all right.
Okay. Oh yeah. I'm telling y'all, I had a dream. I know y'all think I'm crazy. This was about 6 weeks ago. And the dream said everything's gonna be fine. Just be patient and keep telling the truth.
Mhm.
And amen and amen. Always
Have a
walk
fun
in integrity.
vacation. Have a
Yeah.
I
fun
will. I will
vacation.
be in the air in the morning. Y'all have a great night, and thank you so much.
Thank
I
you,
appreciate it.
TK.
Thank
We
you,
appreciate
TK.
it.
Bye, everybody.
Bye.
Bye.